She actually, she had the lip tie, like I knew she had it when she was born. And she also had a posterior tongue tie, which we decided to release. But we didn't touch the lip tie. Um, Probably because she was nursing well, didn't have any issues with it. I decided to just kind of wait and see how that looks as she gets older. So now her teeth, she has 8 teeth, actually not 9 now, and a little gap, I think, because the lip tie attaches kind of in between the front two teeth.
Mhm.
And so I regret not releasing it when she was little because I know that it would have been so much easier. Um, and now I'm kind of thinking, what should I do next? Because she's at the age that, like, I don't think you can do general anesthesia, which I don't think I would really want to do anyway.
So
But
are you finding that she's not, is her mouth open at nighttime, or is she having a hard time getting her lips closed?
you know, that's a good question. I've been observing her, and she sometimes does have her mouth open um, when she's sleeping, but it's mostly when she turns onto her side, not when she's on her back. So it's not consistent,
Mm-hmm.
but I do see that sometimes, and that's really bothering me. And
Okay.
it makes me think, is it because of that lip tie? Because I don't see anything else. When she does have her mouth open, her tongue is up
Mm-hmm.
on the top palate, and I can see that she's breathing through her nose. Because if I close her lips, she doesn't wake up, and she nurses to sleep sometimes too, and obviously she has to breathe through her nose.
Yeah. Okay, there's a couple things. Number one, this is a tough age to treat. So,
Yeah.
yeah, it's a tough age. It's a tough age to treat. But there are some things that you can do. So, number one, there is a procedure called oralase, which is a light procedure. It's a laser procedure that doesn't cut anything. But basically, what it does is it releases fascia in the mouth. And it can release the fascia around the lip tie so that the lips are more like fluid and there's more range of motion in the lips. So with babies, a lot of times we actually do that treatment and you can avoid a lot of those releases completely because you're increasing the range of motion and you're releasing those fascia restrictions. It's super gentle. It's just a light. And we have in our office, we work with Lily. She's our cranial sacral therapist and she does myofunctional therapy, but she also does this oral treatment, works with babies. So she's combining like cranial work with the fascia release and helping the body unwind. Okay, so that would be like a really good place to start with some oral sessions. The second thing that I would recommend is getting a myomunchie for babies. And the myomunchie, the reason why it's so great is because babies like putting things in their mouth, right? So having her put it in her mouth and stretching her lips around it is going to pull and stretch the lip muscles to try to get, again, that fascia to release and get those lips stronger so that the lips will be able to stay closed at nighttime. So with a baby that age, like I said, it's tough because you're not going to want to go in there and probably surgically remove that. That's going to be pretty traumatic and the general anesthesia and all that. But those are two things that you can do. You can get the myomunchie. Let's see, she's 17 months, so I have to check the website. I think the cutoff might be 18 months or maybe two. But they have different sizes. There's a baby size and then there's a toddler size. And you basically just you have them chew on it. So they put it in their mouth and you have them kind of encourage them to chew. And what that does is it increases saliva flow, but it also helps strengthen the lip muscles and it gets the lymphatic drainage going and it helps the jaw muscles get stronger and it helps with facial development. And so, with a baby that's 16 months old, there's going to be a lot of growth ahead of her, and we want to set up the proper foundation. So if the nasal breathing is good and the tongue posture is good, and all of that feels really good, but it's really more of the lips that need the strength. The Myomunchie is a really great tool to help with that. So that would be my recommendation in this age. And then we kind of see how it goes. We see how the progress goes. We're not going to like be doing mouth tape on a baby, right? So that's what we can do that's more minimally invasive. And then as she gets a little bit older, then you can do a little bit more intervention. But that's probably where I would start.
Okay, thank you. I'll definitely look into those options. But the oralays,
Hmm.
um, what is that kind of like? I'm not quite sure that my daughter would be compliant at this age.
It's really easy. It's like taking a flashlight and shining it on her chin, around her face, on her, forehead. It's actually babies love it. It's really amazing. A lot of times babies will come in and they're like tight and they're crying, and then they do the Orlays and their whole system just kind of relaxes. So
Mm-hmm.
it's actually quite pleasant. It doesn't hurt at all. And we actually will go into the mouth, and Lily is really, really good with babies. She loves working on babies. And she's taken lots of classes in infant cranial sacral therapy and all that. So we don't usually have an issue with compliance necessarily, but of course, with any kid, you're not going to be able to have them probably sit in your chair for a whole hour, right? So we kind of
Mm-hmm.
feed the kid. We want it to be a positive experience for her, right? So if she starts crying and fussing, it's like, okay, we're done. Like let's be done, because we want to create like that positivity, right? For her when she comes into a dental office.
Mm-hmm.
But for the most part, babies do really well with it. They love it. My daughter is just turned 3, and I've been doing orals on her since she was that age, and it's actually easier to treat that age than it is a 3-year-old because three,
Mm-hmm.
they get more wiggly, and object more. So yeah, so I would bring her in and try it and see how she reacts. And you can try it out too. Like a lot of times Lily will treat mom as well as baby, and it really helps like regulate the nervous system, and like I said, releases that fascia and can
Mm-hmm.
help with any tension that there might be from that lip tie, and maybe help bridge that gap until you can get it surgically released. If it goes all the way through the front teeth into the palate, you probably are going to need to release that at some point surgically.
Mm-hmm. Mm-hmm. Okay. I think it kind of attaches like right. Um, I don't think it goes to the back. It's attached somewhere in the front, but I don't think it goes to the back.
So you might see, so over time, if it doesn't go all the way to the back, studies do show that that will move up.
Oh, okay.
The top lip tie will actually move up and improve over time. So the bottom one doesn't, but the top one does for some reason. I don't know why. It's
Oh,
just the way
okay.
that our jaw grows. But anyways, so but if you're looking for like if her mouth is open when she's sleeping and the lips are not strong, then you could definitely work on that with the Orlays and the Myomunchie now to just set that foundation, right?
Mm-hmm. So how long is a typical oralays session?
Typically we would schedule about 30 minutes to an
Mm-hmm.
hour. A lot of times because Lily is treating the mom as well. So she wants to make sure that you experience it as well. And so we give you more time. But again, with a kid that age, we're going to treat them until, we do as much as we can and maybe have to build on the sessions. Um, because every kid is different. Again, we want it to be a really positive experience. And if there's a lot of
Mm-hmm.
tension, we're not going to push it. We're not going to force anything
Mm-hmm.
on a kid.
So do you think it's likely that she would open her mouth when she's sleeping because of that tie, or could it be something else?
It's
What
very,
are other options that?
it's quite likely that she's opening because of the tie.
Mm, okay.
Yeah, if it's a pretty strong, I mean, I can't see her, but if it's a pretty strong one that comes down and attaches and is really thick, a lot of the times if you release those, the mouth just closes.
Mm,
So
mm-hmm.
it's because that is literally pulling
Mm-hmm.
up.
Mm-hmm. Yeah, I can actually kind of see it in the front on her lip, I can actually kind of see that kind of like that string, string like kind of pulling in the front.
But the orales can release all of the fascia around, right?
Mm-hmm.
So it can really make a big difference in how, like in the lip closure, and the function.
Mm-hmm.
So that's why
Mm-hmm.
I would say try that out. It's really minimally invasive, it's just light, but it's very powerful.
Okay. Okay. That's good. That's good because I did take her to a dentist, and they actually suggested it as an option to release it at this age. And it just didn't sound good with
I feel
no
like I would be
anesthesia.
hard. I mean, being a mom myself, having a 3-year-old, I just don't know if I'd be able to put my daughter through that, to be honest. I mean, yes, I guess you could do it. You could do anesthesia and all of that, but I think at the end of the day, you have to weigh the benefits and all of that, right? Like if she's not having major airway issues, if it's not all the time that you're seeing it, and I would always, my inclination is always to try more minimally invasive things before you just jump into cutting.
Mm-hmm.
You know,
So,
Maria, what has happened in that field is we just didn't have any other solutions besides cutting, besides doing the fiber release. And with the Oralays, now they've realized that a lot of the problems are really the fascia that just gets
mhm.
so bound up and so tight that it prevents the movement of the lips, right? So we're excited about it because you know the classes that I've taken in the past or what have you, there weren't any other options. You cut. You literally do a lip or a tongue tie release. And now with these lasers, they're really discovering some really cool non-surgical ways of getting around that. And anytime you
Yeah.
can avoid surgery, you know, anytime you can avoid surgery is always going to be better. So we recommend that you always start with the oral A's first because
Yeah, even the surgeons that are teaching this procedure are recommending that you start with Orlays, which is crazy because they were the ones preaching cut, 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 right? So if I think the field continues to progress and we continue to learn more, and now the thought really is this is fascia, and we need to make sure that we need to rule that out before we just go start cutting. So anyways, if it was my daughter, I'd start there. And you may still need a surgical tongue tie release, but I think you could still see a lot of that functional benefit come out of the Oralase treatment and the myomunchie, and just doing some of those other minimally invasive things might really help you bridge the gap until she's older and you feel comfortable doing a release.
Mm-hmm. Okay. Yeah, that's good to know. It's been worrying me.
Yeah,
Yeah.
Maria, and then I just put in there on the chat information about the Maya Munchie. Dr. Taylor has a podcast that talks about the oral A, so the link is in the chat.
Mm-hmm. Mm,
Yeah.
okay.
Yep.
Okay, great. I do see
You
that.
can
Mm-hmm.
copy that and then just take a look at it.
Okay, thank you.
Mhm.
So my other question is about bacteria that causes decay. Um, so I had pretty poor um, kind of oral health when I was little. So did my husband and my parents and his parents. Um, could have been because we grew up in a pretty poor country in Eastern Europe. Um, Maybe it was a nutrition factor, but we all have that bacteria. And um, my question is, what would you recommend doing so that we don't pass that on to our children? I don't know if it's maybe too general, but I have a lot of, like, for example, I have a lot of fillings. I have several crowns. Um, and I assume I still have that bacteria, even though I'm like keeping up with the hygiene, trying to do the best I can. And so is my husband. But I assume we still have some of that bacteria. Is there something we can do for ourselves, something we can do for our daughter?
Isabel, do you want to
Yeah,
take this
Isabel,
one?
you want to
Or do
take
you want me
this
to take
one?
this one?
Mhm. So
Go ahead, Isabel.
one of the things is you talk about this specific bacteria, and we all have bacteria in our mouth. The important part is to have balance and just balancing the microbiome in the mouth, because you can not only have bacteria that causes decay, you can also have bacteria that causes inflammation, and then there is going to be bone loss, and it's just kind of a snowball effect. So as you mentioned, nutrition is a really big part of having healthy mouth. So nutrition, balancing the bacteria, balancing the pH, the acidity in the mouth is another big factor. Genetics play a part of it, but is not the main part of the problem when we're having issues in the mouth. It's just all these different things that I mentioned, and Dr. Taylor can and Dr. Carroll can talk a little more about other factors, but I feel like the majority of our cases, they go to conventional dentists and they just want to make the teeth stronger using and recommending fluoride. I had a patient yesterday, and his teeth have a lot of cavities, but he has a good oral hygiene. What we found out is that he's having gut issues. So there is a lot of problems with his gut. And the thing is that the beginning of the digestive system is in the mouth. So if you're having an imbalanced microbiome in your mouth, then you can see effects not only in the mouth, but also in your gut. So that's kind of finding the root cause of the problem. It will be the best thing to do. So find out if your acidity in your mouth is, or if your pH is acidic. And there's test strips that you can find to test your acidity. You want it to be around 7. That's the normal. If it's below that, then that means that there is more acidity, and it kind of draws minerals from the tooth structure. The other thing is the oral hygiene and having your hygiene appointments to find out exactly how you are brushing, and if you're missing different areas, and you're probably not having a good technique in certain areas, and especially when we're talking about crowns, between the crown and the tooth, that area has a tendency to accumulate a little more bacteria. So then you have to brush a little bit better. Dr. Taylor, I think it was more kind of like an experiment with protein, having a little more protein in her diet. And you can talk a little bit about that, but it's just they found a big difference.
Yeah, I would say, so first of all, if you want your kids not to get decay, the foundation is really nutrition. So
Mhm.
go look up Weston Price and follow the guidance of Weston Price. Weston Price was a dentist that went all over the world in the 1930s and went to primitive populations and found that all of these people had no cavities and no periodontal disease, and they didn't have bad bacteria in their mouth. And then he went to neighboring towns where more processed food had been introduced, and same genetics, just eating a different diet in a different environment, now all of a sudden had cavities, crowded teeth, periodontal disease. So he attributed that to the lack of fat soluble vitamins that are in our diets today. And like the diets back then had 10 times the fat soluble vitamins. So that's vitamin A, vitamin D, vitamin K, vitamin K2 specifically. And vitamin A, that's found in organ meats like liver. We used to eat a lot of liver. We don't do that anymore, right? And vitamin D, and vitamin K2, all of those are really, really important in proper calcium absorption and making sure that teeth are healthy, right? When our body needs mineral, it pulls from the teeth because that's a store of mineral. So if your body is getting enough mineral and your digestive system is good, so the good food that you're putting in is going to the right places and it's being absorbed, then you're going to have all the mineral that you need, right? And the fat soluble vitamins help that mineral get into the teeth. So when we talk about remineralizing teeth, we have to really focus on fat soluble vitamins, and really up those. So I think every kid should be on cod liver oil. Every kid, every day should be taking cod liver oil because that has naturally occurring vitamin A and vitamin D. And then every kid should be eating grass-fed butter, or they should be getting some kind of animal fat that's going to provide that K2 for them. So you really want to focus on that. There's a book called it's by Sally Fallon, and it's nutritional degeneration, and she has one that's for babies and kids. And
Hmm.
she talks about foods and recipes and what babies should be eating and what kids should be eating. And it's a really great guide. It was my Bible when I was pregnant and when I had my daughter and we were doing food and everything, because it taught you like how do you feed a kid a nutrient diet so that they have all the things and all the building blocks that they need to build a healthy brain, to build healthy teeth, because some of this is genetic, but a lot of it is environment. Most of it is environment. So if you are giving them the proper nutrients, then that's going to cause their gut to not be as inflamed, and it's also going to allow them to get the nutrients into the body, and the body's going to function a lot better. So that's, to me, nutrition is like the foundation. You've got to get that dialed in. Cavity bacteria can only eat carbohydrates, and then they eat carbohydrates and they poop out acid. And the acid is what actually causes the cavity on your teeth. So if you have a cavity bacteria that's the acid producing kind, if you give it fat, it's not going to be able to make a cavity. If you give it protein, it's not going to be able to make acid and make a cavity. So you want to make sure that you're prioritizing good fats and good proteins, and you want to stay away from carbohydrates sticky carbohydrates that will stick onto the teeth, right? And the bacteria will eat the carbohydrates and they'll poop out acid and cause a cavity. So if you're going to do carbohydrates, you want to limit them, and you want to stick to like fruits. That would be like the best kind of carbohydrate probably. If you're going to do grains, you want to make sure they're fermented. So they're broken down, because it's hard for the body to digest grains. It's more inflammatory. And that Weston Price diet, they talk all about this. So anyways, I would really start there with your kids, and then make sure that their lips are closed at nighttime, right? Because if you have an open mouth, that's going to cause the saliva to dry out, and that's going to cause more acidity in the mouth. So mouth breathing
Hmm.
can be a really big thing, or just an open mouth can increase your risk of decay. Um, and then if you feel like you need more support, you can add in like a nanohydroxyapatite toothpaste. I'd never recommend fluoride in kids or adults, but you can add in like a remineralizing toothpaste that will help buffer some of that acid as well. But really, a lot of this is diet and gut health.
Hmm. And Dr. Taylor, would you be able to share maybe what your daughter kind of typically eats in a day, and when, like, breakfast, does she have snacks? Maybe what kind of
Yeah.
snacks you give her? Just a typical day.
Yeah, so for breakfast, she usually has an egg with some butter or like tallow, and then she'll have either bacon, or she'll have lamb sausage, or she'll have some other kind of like meat protein. Um, that's usually breakfast. I don't give her any bread. I might give her a couple wild blueberries. She might have a couple bites of a Greek yogurt, or something fermented, like a coconut yogurt or something. So typically her breakfast is just protein and fat, and I really limit the carbohydrates. For lunch, she loves zucchini noodles with chicken. She's a fan of pesto. She'll eat like if she goes to school, then I might send her with some meat sticks and some salami and maybe some apples. So she's eating mostly, like I said, like protein and then fruit. And then at dinner, like let's see, last night she had grilled chicken, and she had some wild blueberries. And I don't really give her that many snacks at 3 years old. You really should be able to just have 3 meals a day. So um, I actually found that when she snacks, she doesn't eat dinner, and it's like that's when like she doesn't eat the 3 meals, and that's when I want her to get the nutrients in, right? Like that's the real food. So if we're gonna be gone and we're gonna be snacking, I'm grabbing a thing of meat sticks. She loves olives. That's another loves olives. Or grabbing an apple. You know, if we go to the grocery store, I'll grab an apple and she'll eat that. She loves lamb. She loves steak. She loves basically all of the meats. And it's interesting because when you feed them that way, they tend to not be as interested in the other types of foods. Like we'll go to a birthday party and it's like, oh, here's a cookie. And, she'll take like 1 or 2 bites and be like, okay, I'm done with that. So it's been really interesting just to kind of watch her and what she prefers. She's always interested in the meat. I have not really prioritized vegetables with her because if you go through and you read Sally Fallon's book, the nutrients are in those fat soluble vitamins, and you're going to get those from animal fats and animal protein. That's really what builds healthy bodies. And so the vegetables to me are kind of a condiment. So I'm not freaking out about getting her spinach in. I'm not freaking out about making sure that she eats all of her broccoli on her plate, like, or her salad. Like, to me, it's great if she wants to try it, she can. But in fact, there's been some of those foods like spinach has a lot of oxalate in it, and oxalate actually depletes your minerals and it can cause decay and it can make your cavity risk higher. So a lot of the healthy foods like the spinaches and all of the like beet greens and all the things that they try to squeeze into these like baby pouches because they think it's more healthy. A lot of that actually can be damaging because of the oxalates. And I just did a podcast actually with Sally Norton, and she wrote a book called Toxic Superfoods, and she talks about this, and it's really fascinating. And it lines up with that Weston Price diet and nutrition that makes sense to me. So,
Mm-hmm.
anyways, I would just make sure that you're prioritizing those things. And, animal fats and proteins and fruit, great. And if you can squeeze in a few veggies, fine, but I'm not beating myself up about the veggies. And you will
Mm-hmm.
find that there's very little plaque on their teeth. So when you feed your child that type of diet, at the end of the day, take your fingernail, scratch their teeth, see if there's any white stuff that comes off. There's barely any. It's amazing. I actually did a diet where I only was eating meat for 6 weeks, and it took me like days to get plaque off of my teeth. Like it was crazy how little plaque accumulates on your teeth. And that plaque is what causes the cavities, right? It's the acidity in the plaque that's sitting on your teeth that's going to build up and cause that decay. So if you stop feeding it all this processed stuff, these carbohydrates, the sticky stuff, all the sugar, it's just not going to be able to break down a tooth.
Rebecca,
Mm-hmm.
can you go ahead and talk about the toothpaste that you have Quinn on for a
Yeah,
moment?
I have Quinn on Revitin actually right now, and Revitin is a prebiotic toothpaste, and it helps basically build a healthy microbiome in the gut and in the mouth. So it's not killing anything. It's just basically acting as a prebiotic to feed the good bacteria and encourage those good bacteria to have more babies.
Mm-hmm. Mm-hmm.
So that's what I have her on. It's really safe. Um, if
What about
if
supplements?
so supplements, I have her on fermented cod liver oil. She takes that every day. And then I also have her on a spore-based probiotic, and I prioritize fermented foods. She also takes magnesium, and like before bed, she'll take a little magnesium gummy. And then, but I feel like that's a little bit optional. But I think a lot of us are deficient in magnesium. And then sometimes I'll give her some glutathione because I take it and she likes the taste of it. And I know her detox pathways probably need some help. So I give her that as well. But she also was exposed to black mold, and so she
Mm-hmm.
developed some gut issues like from that mold exposure, and she developed some eczema after that happened. And so I've had to like rebuild her gut, and I've been testing her gut since she was 10 days old. So like I've been able to track her microbiome since her birth, basically. And when we had the mold exposure, there was a huge shift in her microbiome, and that's when she started to get eczema and skin issues. And so that's why I started her on the spore-based probiotic. And we did some binders, like some colostrum binder as well. But that was so she's taking that kind of as a maintenance type of thing now. But I got her on that initially because we had an actual like exposure and she had a need for it. But I don't love a ton of supplements. Sometimes I'll take the liver capsules, like dehydrated liver, and I'll like put it in. I make like a chocolate pudding with hard-boiled eggs, which sounds disgusting, but it's delicious. But you can put liver into the chocolate pudding, and she'll just eat it. So I'm trying to get the organs in, because those are the super nutrient dense foods. So
Mm-hmm.
however you can squeeze them in. Sometimes I get them into like taco meat, I'll like you can buy ancestral blend like ground beef or ground bison, and it has like kidney, heart, and liver already in it. And if you put some taco seasoning in that, nobody can taste it. So I love squeezing organs into anywhere, like any food that I can, to get kids to eat it. So
Mm-hmm.
instead of the spinach that I'm putting in the smoothie, I'm like putting organs in the smoothie, right? So that's what I prioritize in her.
And what about dairy?
So dairy, she does raw goat milk, like that's what we have in our house. She doesn't like she'll drink some every, it's not a daily thing for her. She's not always like, let me have milk. But we stick to raw. She does do some cottage cheese. She does some like Greek yogurt. So like more of the fermented stuff. I don't really avoid dairy because I haven't really seen that she's had an issue with it. Her dad is really sensitive to dairy, and so I've had like a hawk eye on that. But I haven't noticed like congestion or any real issues with dairy. So, but I'm also giving her like good quality dairy, and I'm not giving her a bunch of junky dairy. And it's not a primary food group for her, right? It's kind
Mm-hmm.
of more of like a couple bites of yogurt. It's like, oh, here's, I'll give her like a little brie cheese, but it's not like she's just sitting down and having like a big gigantic bowl of, milk and mac and cheese and, all that junk.
Mm-hmm.
So,
Mm-hmm. So you completely avoid wheat?
yeah. Yes.
Yeah,
I
that's
mean,
that's a tough
if
one.
she, yeah, if she goes to like, a friend's house and it's a birthday party and there happens to be a thing, I'm not like, you can't have that. But I do notice that her skin, her eczema, when she had that eczema, it would tend to flare up when she had gluten. And I know that her dad is sensitive to gluten. And I just know from all the education that I've had that gluten is very irritating to the gut. And so we don't have it at home. And if you're gonna do gluten, if you have to have it, then I'd say like make sure you're doing like sourdough and you're fermenting those grains because any of that bread is going to be, unless it's fermented, it's going to be really inflammatory. And even if it is fermented, it's sticky, it's going to be able to convert into a cavity and acid. So if you're really trying to be picky about cavities, you're not going to be eating grains and you're going to be cutting out a lot of those carbohydrates. And the thing that I like about like an apple, for example, is that an apple to eat it, you have to crunch it and it's kind of cleaning the teeth as you're eating it,
Mm-hmm.
right? Versus rice that's going to get stuck into the teeth and it's just really, really sticky, right? So an apple's got a lot more fiber. It tends to be more cleansing of the teeth versus a lot of those other carbohydrates like bread, pasta, those types of things. So we pretty much avoid all of that stuff. And like I said, if she's out and about, I'm not gonna like I don't want to like food shame her or make her feel like whatever. But the
Mm-hmm.
interesting thing is that when you give them better foods, they tend to want those types of foods. They're used to those types of foods. And so you have an amazing opportunity with a 17-month-old or a 16-month-old, and you get to kind of imprint in them like what makes them feel good, right? Like, hey, when I eat this, I feel good. And then when they try a piece of, if they go and have this, really sugary whatever thing, they're going to be like, oh, I don't like this, or this doesn't
Mm-hmm.
taste good, right? You're literally training their taste buds. It's really a cool time to have a young baby because you have so much more control over
Mm-hmm.
that. over
Well,
what
that makes sense. That makes sense when the child is a little bit older and can chew, but with little ones, it, it's more difficult to get those meats.
I don't know. You should go look at my social media. My daughter is gnawing on pieces of steak and ripping lamb when she didn't even have teeth. So it's Um, if you go to that Weston Price book, they have
Mhm,
so many recommendations for parents on how you get this in. It can be pâtés, it can be,
mhm,
liver pâtés, it can be, you can process and grind it up if you want. But to be honest, I want babies chewing. I want them chewing. They should be chewing because that's going to stimulate their jaw to grow and
mhm,
develop, right? So one of our problems is that we've been giving babies all of this processed food because we're terrified that they're going to choke, right? And so, but what does that do? Well, it makes it so that this whole jaw complex is lazy, right? And if you don't use it, you're going to lose it. So what builds bone and is the muscles, right? The muscles have to be putting stress on the bone, and that stimulates the bone to grow. So if the
mhm,
baby's not chewing and they're just getting purees, and they're not getting nutrient dense diet, they're going to have a lot of problems.
mhm,
So
mhm,
I like my one of my daughter's first foods was just like a lamb like riblet thing, and
mhm,
she just gnawed on it. And like I
mhm.
don't know, she just got all the juice out of it, but she it was amazing to me what she could eat with no teeth. It's really amazing. So yeah, it's a different mindset, right? And as a parent, you're like, oh my gosh, that's terrifying. And I'm sure I got a lot of weird, dirty looks when we go out to eat, but honestly, it really was fine. And I think that she learned actually how to manipulate food better and choke less because she was introduced at a young age and had to, she had to learn how to do it. And if your kid never chews, then they're 7 years old and they just want mac and cheese because it hurts their jaw when they're eating a steak, right? So
Mhm,
we want the jaw to be strong. And back in the day, we didn't have blenders. We were not able to blend up all this food for babies, right? So what were we doing? Well, babies were eating real food, you know?
mhm,
Maybe mom was eating, breaking it up a little bit and then giving it to baby, right? So but that Weston Price book talks a lot about this. And, I didn't invent this concept. So
mhm,
it's like I said, it was my Bible when I was pregnant. They have a whole diet for when you're pregnant so that you can have a healthy baby and you have the nutrients as a mom to give. And then they have a whole breastfeeding diet. And then they have the baby's first foods and what you should introduce first and all of that. So it's a really, really good resource.
mhm. Okay, thank you. I will definitely look into those. Um, Another question that I wanted to ask is, what are your thoughts on this paste that's called MI paste? Have you heard about it?
Yes.
I know that some offices that are, well, they're not really holistic and biological, but they're kind of maybe trying to add some things like and removing fluoride. I've noticed several offices have this MI paste.
Isabel, can you take that one?
Yeah, well, Dr. Taylor mentioned that we are not a big fan of fluoride, and my paste has fluoride.
No, doesn't have fluoride.
It has some sodium fluoride.
They
There,
have they have
It's
one.
calcium and phosphate, I thought.
They
no,
have MI paste plus, which does have fluoride,
Yeah,
and then the other one does not.
yeah.
well, so if it doesn't have fluoride, because the one I knew it had fluoride, and I don't like that. But if it doesn't, you have everything, every single thing that we recommend needs a purpose or has a purpose. So if the patient is having, and I know they used to use this MI paste for white lesions, or when the patients have like the tooth structure was not mineralized, they use that to help remineralize the surface. So I'm not sure, depending on what it is that they were recommending that to you. Was it because they were recommending it or you heard about
Yeah, it was not exactly a cavity on a tooth, but something that kind of maybe the beginning of a cavity.
So I feel like MI paste is an option, but there's a lot, and that's been around for a long time. And there's a lot more newer things that we have seen really good results with it.
Mm-hmm.
Where was the lesion or the area that you were trying to remineralize? Was it on the outside surface or
Yeah, yeah.
in the
And
teeth?
on the outside, one of the front teeth.
Mm-hmm. So there is a product that we're using, and we were actually talking about it this morning, and it works really good in between the teeth, but when it's just that surface lesion, it can't work on those lesions. So it will be either that, the Curodont, if it's just for the outside that surface, there is another product that was working okay with those lesions in the facial or the outside of the tooth, which it was called Icon. And that one works okay for the surface, not so much in between.
Is it something that's done in office or at home?
No, it's something that is done in the office.
I would
Mhm.
say it too. I think that nanohydroxyapatite, like a 10% nanohydroxyapatite, is going to be much more effective than MI paste.
Mm-hmm.
So if you are just wanting something topical, like what should I brush with at home? What can I rub on that spot? I would be jumping to the hydroxyapatite.
Mhm.
I like the brand Dr. Jen's. That's my favorite brand. And that's gonna be to me like MI paste on steroids. So that's
Okay.
my favorite. And then also ozone is another great way to help like take all the bacteria out, neutralize the acid. And so that's another procedure. You have to do that in office, but it's really easy. I mean, it's just like putting gas on the tooth
Mhm.
for about a minute, right?
Mhm.
We see that when we treat lesions with ozone, we are actually seeing the minerals come back. It's really cool. So that's another thing. That peptide treatment can be really great to help rebuild and remineralize the enamel. The icon treatment is more of like a filling type of treatment option, but it will get rid of those white lesions. So there's lots of different options. But again, you got to go back to the diet, right? Like, why is there a cavity there in the first place? Get that microbiome balanced out, give the body what it needs, make sure that the nutrients you're putting in are getting into the body. So, whenever I see a patient that has cavities, I'm always asking, like, okay, we can fix this, but why is this here, right? It shouldn't be here. So at our office, we really spend the time with patients to kind of go down that rabbit hole and figure out, like, why? What are your risk
Mhm.
factors? Why is this here, right? So, but yeah, I would say if you're just looking for something to brush with that and you want that
Mhm.
remineralization effect, I would go with Dr. Jen's. That's my
Mhm. Mhm. Okay, thank
you can
you.
use that on your kids too.
Mhm.
They have a strawberry flavor one. You can use that on your kids as well.
Mhm.
If
And
you
if I
if you're
was
worried
to
about
bring in my daughter for the Orlays treatment, is
that.
that something that I can just call and schedule just for that treatment? Or do
Yeah.
I have to bring her in for like a new patient exam and
You
then
can have the
schedule?
treatment, you can have the treatment same day. So we legally have to do an exam, but it's a very quick,
Mhm.
fast exam. We don't charge a lot for it. It's just kind of like so that we can make sure that, we're following the rules.
Mhm.
And then you can just come in and see Lily. So the exam is a few minutes. It's just a hi, how are you doing? Let's
Okay.
look at the lip tie. Okay, great. You don't have to go through like the whole new patient process, blah, 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 right? And then you can have a treatment that same day with Lily, and then we'll basically come up with a plan. Like I said, usually we want to do 4 sessions and we want to do them twice a week. So we do basically 4 sessions in 2 weeks, and then we would reevaluate and see, you know, see how it's going. So that's typically the protocol that we would recommend. And then we might recommend a myomunchie or something else that would help just strengthen those lip muscles.
Mhm. Mhm. Okay, can you repeat again how many sessions are typically recommended in what time period?
4 sessions, 2 per week. So 4 sessions total over 2 weeks.
Uh-huh. Okay.
You want to do them about 3 days apart.
Mm-hmm. Mm-hmm.
So 2 to 3 days apart is kind of ideal. And it's best if you combined it with some kind of body work within 72 hours. But Lily does that body work when she does the orales. So like a lot of dentists will do orales and then you have to go get chiropractic or you have to go get do an osteopath or do an additional appointment somewhere else. But because Lily's trained in cranial sacral therapy, she is doing that body work with every session, so you don't have to go do that somewhere else, which is great.
Okay, thank you so much for all the information. I
You're
really
welcome.
appreciate it.
You're welcome.
Lots of books to get and read.
Get that book. It's really good. It's really, really good. Yeah.
I posted it on the chat as well, and the information about the Dr. Jens and everything that Dr. Taylor was talking about is in there.
Okay, I see that. Oh, perfect.
Yeah. And if you call to make an appointment with for orales, you're gonna want to call, you're gonna set it up. It's actually at O2 Dontics. So we are right across the street from Green City Dental, where we do that procedure. And yeah, you'll want to see Lily. So they should be able to help you get that set up.
Okay, thank you so much. Appreciate your time.
You're welcome.
You're welcome. Maria, have a nice night.
Thank you. You too.
Thank
Bye-bye.
you, Maria.
Bye.
Bye. Okay, I guess we're gonna see everybody next month. Okay, she's gone.
That was
We're
a lot
still
of talking
recording.
for one person.
I know.
But good.
When I saw the little baby in her arms, I'm like, oh, this is for Rebecca.
Yeah.
We
This
can
session's
stop
gonna be
Did
for
you
recording.
learn
Rebecca.
anything? Would you have answered the same way?
Well, I don't know enough about Weston Price and, yeah, I think I could have gotten through some of that. You never talked about xylitol. I thought that would have been something to
I
add.
hate xylitol.
I know you do, but
You want to stop recording?
Yeah.
yeah.
Oh, me.
Yeah.
How do I do that?
On the bottom, it says record, then just click on that.
Stop recording.
So she